everyone. I'm Cherry Houston with Critical Learning Systems. I'm here to introduce you to the Oral Health Needs Index Project. Our destination and target area is data measurement. We work at the national level, building all kinds of relationships within Open, some of which are project partners, focus group facilitation and participation, thought leaders and case study partners, data collection and training meeting sites, webinar facilitation and evaluation, and many other partnerships that we found within the Open Network.
The Index is an interactive geographic visualization of demographic data, social determinants of health indicators, and community infrastructure such as public transit juxtaposed with dental provider locations. These can be a powerful tool for health professionals, policymakers, researchers, planners, or community organizations to understand the where of oral health needs and disparities. The highlights of the index are the variables, community maps, scoring and/or measurements, dashboards, and story maps. Factors important to each community story map are variables and data sets added by community organizations and community members. They tell their own stories. The maps in social determinants of health and elder access to dental providers allow interactive evaluation of where people aged 65 and older live in relation to dental providers and public transportation routes, and whether the census tracts they live in are potentially vulnerable areas based on the case study Social Determinants of Health Index. These data visualizations can be used to evaluate and prioritize elder access to dental providers in the case study area. The case study story map for the Elder Dental Program focuses on access to dental providers for populations aged 65 years and older in Bristol and Norfolk counties, Massachusetts. Built on Esri's ArcGIS Story Map platform, the Case Study Story Map uses map layers from the data mapping dashboard to present population data, social determinants of health indicators, dental provider locations, and public transportation routes in an interactive digital narrative. Additional story components could be added to the Elder Dental Program Case Study Story Map from the data mapping dashboard, such as the locations of long-term care facilities. The Case Study Area Social Determinants of Health Index uses both nationally available data from the U.S. Census and locally available data. The method for calculating the Social Determinants of Health Index included calculating z-scores for each indicator by census tract to standardized values, finding the correlation between income and other indicators in the set, assigning a sign, plus or minus, to each indicator based on correlation to income, adding the z-scores for each census tract to represent a comparative value of social determinants of health distress or vulnerability. Some of the challenges consist of obtaining funds to procure relevant data sets, i.e. dentist locations by specialty, and integrating those into tools and models for organizations, and support community-based organizations to collect data, report accurately, and learn to input into dashboards and story maps.
Our partners from the Fullerton Laboratory for Spatial Technology at Middle Tennessee State University developed the online data dashboards, the mapping dashboard, the story map, and other technical aspects of the index. But this could not have happened without the input of our open partners and their community partners, and partners who corrected data and who nuanced data to fit their own communities. So in that regard, we look forward to the continued relationship within Open and encourage the participation of others outside of Open.